Welcome. My name is Fred Sandoval. I'm the Executive Director for the National Latino Behavioral Health Association. Thank you for joining us for today's monthly series called Pláticas, Latino Wellbeing During COVID-19. NALBA is a nonprofit agency dedicated to the well-being of Latino families and communities across the United States. Our mission is to address the disparities affecting the behavioral health of Latinos. We're excited to continue our monthly Plática series on how Latinos and their families can and do take care of their emotional, physical, and spiritual well-being during COVID-19. We are proud to host this Plática, which is made possible by the support of Morehouse University, which is a nationally funded agency to support the National COVID Resiliency Network. This support is done by the U.S. Department of Health and Human Services Office of Minority Health. Each month, NALBA hosts a professional expert from community development, public health, behavioral health, or the field of medicine to share their insights, their perspective, and to provide information on resources available to your community anywhere where you live in the United States. It'll help to be able to address the impact that COVID is having on the Latino community. Well, to get us started, here's how it works. I get to introduce our wonderful guest today, John Martínez. I'll share his bio with you so you get to hear a little bit about him. And then we're going to ask him to add a little bit more, of course, when we get the interview started. But here's how the Plática works. You, the live Facebook audience, gets to listen in, and what we'd like to do is encourage you to make comments, like the comments that are shared. If you have questions, please share them. We'll do all of this so that we can share some of this information with John and give him an opportunity to comment on the live chat that's taking place concurrently with the Plática. So here's what we'll do is I'm going to go ahead and introduce John Martínez, and then we're going to get started with the questions. John Martínez is the executive director for the program agency called Centro Campesino Incorporated. He has over 30 years of experience working with community-based organizations in several areas, including economic development, housing, workforce, educational investment initiatives, organizational development, and community development. All of that to say that he has 10 years of national experience and expertise developing multicultural outreach to Latino communities. And this as a result of directing a workforce of technical field consultants providing organizational development consultation in the areas of program improvement, board training, strategic planning, trainer training, and other community initiatives. So you can see he has a great deal of expertise in areas that support the organizations that support the Latino community. John grew up in Española, New Mexico, just north of where I'm actually located here in northern New Mexico. He has deep roots in northern New Mexico, particularly in the Rio Arriba and Taos counties. He's an Indio Hispano whose ancestors arrived here in the early 1600s, while others have been in the Americas for generations and for a very long period of time prior to that. John is a summa cum laude graduate in political science from the University of New Mexico. He holds a Master's of Science degree from Louisiana State University and attended the Conexiones International Honors Program in Mexico. His professional work experience includes leading a community development corporation, a statewide community action agency, directing a rural USDA-supported enterprise community, leading an urban school-to-work initiative, and has served as the National Director of Workforce Development for the National Council of La Raza, formerly called NCLR. It is a Washington, D.C.-based civil rights and advocacy organization, presently known today as Unidos US. John was selected, incidentally, to the 2023-2024 Neighborhood Works America Achieving Excellence Program at the Harvard Kennedy School of Government. Kudos to John. That's quite an accomplishment. And of course, it speaks and is a testament to his expertise and his knowledge and his ability to lead and create advocacy and policy changes. He is also a member of the South Florida Community Development Advisory Board for J.P. Morgan Chase and Trust Bank. He is a former member of the Affiliate Council of Unidos US and a senior fellow on Mexico for the U.S.-Mexico Solidarity Foundation. So you can see John brings to us just incredible expertise, his experience, his knowledge, his deep passion, his commitment to serving the Latino community has been going on for decades. And just to add a little side note here, I've known John for many of those years, and his trajectory has always been from here to there. And it's in large measure because of his own ambition, his own motivation, his commitment to improve the well-being of Latinos in our country. And John, you certainly have done a remarkable job in your career. You're a role model, you're a champion. It's just, we're so blessed to have you here with us today. And with that, we'll get started. And I know, John, you're going to probably say, what else can be said? Well, you might add a little something more. So anything else you'd like to say about yourself, John?
Buenas tardes, Fred. Thank you so much for inviting me and to participate with this Plática and have some great conversations and have other folks listen and partake. Let me, first of all, let me apologize for the bio. I hate talking about myself, but that's my bio. I would say the most important thing, and this is true of Fred and myself, is that we've learned more, we've developed more by listening to people and than by talking and telling people what we think our ideas are. And I'll tell you that that's definitely true for myself, and I know it's true for Fred as well.
Well, your humility has always been part of your characteristic, John, and I'm excited to have you here today. I know the listening audience is going to really benefit from hearing you really impart, these experiences and knowledge, because, in some ways you get to mentor some of these up and coming leaders in the Latino community. And of course, Latino is a big word for a lot of different groups across the United States, because even though you are presently in Florida, you've been in other states. So you have had a very big reach for many years, and you talk from incredible experience. So I hope that the listening audience gets to hear how rooted you are in community, how deeply passionate you are about this work. And so I'd like to learn myself, and if you could impart with our listening audience more about the mission and the work of Centro Campesino, because if you think about the work you're presently doing, it speaks volumes to the staff that you have, the programs you're operating, the populations you impact, and what's particularly unique is that you're in Southern Florida, right? So please highlight that, and we'd love to hear, of course, the services you deliver to farm worker communities. It's a very telling situation about the farm worker community, because most of us may not recognize how significant that is to the American economy and to our own well-being. What farm workers do contributes to our well-being. So, John, go ahead.
So, Fred, you provided a leading point right there, so I have to respond to it. Yes, I have lived and worked in 6 different states. It used to irritate my daughters because they would tell me all I'm doing is looking for primos in other parts of the country. And to some extent, that's true. We have so many connections across the country, across the world. And part of my development is meeting people and learning what's unique about us and what's similar more than what's different. Anyway, so yes, I'm the executive director of Centro Campesino. I'm proud to be able to serve in that position. We're a community development corporation that strengthens families by providing affordable housing, home ownership support, and economic opportunities so that people can build assets for themselves and their family. Let me give you some context. Our roots are deep in the farm worker movement. We were created in the early 1970s as the Centro Campesino Farm Worker Center. And Cesar Chavez would participate and visit almost yearly to Centro Campesino and was a fixture at many celebrations. He's long gone past, but the other people that have taken over for the United Farm Worker Union have also been to Florida and participated with us and broken bread with us. So we started off as an advocacy organization to deal with the deplorable living conditions of agricultural workers. Not only were there not homes, people were not wanted. Their work was wanted, but they didn't want them to live anywhere. And the squalor, it was really bad. So it started as advocacy, and then it switched off to people are not going to rent or sell homes, so we're going to build our own. So Since our history, we've built over 500 single-family homes and sold them in the affordable market. The very first homes were basically self-help housing, where the families would help with the initial construction, basically have ownership in their own home. Sweat equity is a term that's used. Since then, we've shifted to other methods of building and selling homes. I will say we haven't built anything since 2016. The market and the numbers, it just doesn't work right now. Anyway, so that's a big line of business for us. We've also helped farm workers or former farm workers access education and either increase their capacity to earn more money in farm work or to transition to other jobs. We have a long history of doing that. And home ownership support, that is helping people to prepare and helping them to access a mortgage and be able to find and purchase a home and keep a home and maintain it, is a very large line of business. That's our history. Right now, probably the last 6 years, we've been doing business at Centro Campesino. Economic shifts, demographic shifts across the country. But so let's talk about agricultural work. California, Texas, and Florida, those are the three major states of agricultural production. And sometimes Florida is number 2, sometimes number 3. But economically, it's number 3 for the state as the economic driver. In Miami-Dade County, you have Miami. In context, Miami is 400,000 people. It's not very large, but then you have a few million in the county that go in and out every day. So in Miami-Dade County, agriculture is the 5th largest economic driver. So it's real important to us in our county, in our state, and across the country. But there's been some demographic shifts in terms of less farm workers for a variety of reasons, some income-wise, some political, some policies. There's less farm workers, and in Miami-Dade County, there's been a shift of those type of work. So I would say the demographic that we serve is very consistent to Miami-Dade County. The majority Latino. We're talking about people from 23 different countries. Those are the people we serve, and the either farm workers or the children or grandchildren of farm workers who still live in the community and all seeking the American dream. The American dream is still alive. It just is a lot harder to access, and it costs a lot more, and almost impossible to find a home and build assets. But people still aspire for that American dream. So that's a little bit about Centro Campesino. I've provided, and I know that you're going to share them on with the folks. We're a NeighborWorks organization, and we had an economic impact of 18 million last year, and in the last 5 years, over $100 million for economic impact. That is the homes that we've been able to help people purchase, the mortgages they've accessed, the homes we've renovated, weatherized homes in 14 counties, and the education we provide to young people and to adults, and the people we've placed in jobs. So agriculture is important to us, again, as a country and as a state, and there's also a lot of concern, particularly when you have issues such as a hurricane or a pandemic happen.
Gosh, John, if you think about the history of Centro Campesino, and thank you for kind of, giving us that context, because, demonstrates how long the organization has been addressing the issues, as you said, initially through advocacy and then through the development and management of programs that really look at the underlying basic needs of any human being, right? A place to live, food to eat, have the opportunity to access community resources, getting a public education. And as you said, the American dream, right? It's this thing where everyone has an equal opportunity to do that. But what we've learned is that oftentimes there are disparities or conditions where that isn't the case. The American dream, it looks too far removed, because the basic needs that people need in order to be able to have those opportunities are limited, not available, or are prevented in terms of their availability to be made to the Latino community. But I did like and appreciate your describing the efforts around the agricultural impact that is in your state, the work that you're doing to ensure that as an economic driver, that the agricultural community, which really in part is really at at the end of the day, it's the basic necessity of all of us here in our country, right? We have to be able to eat well, and to be able to have the benefits of farm workers who are making all of that possible, right? So for that industry who employs farm workers, it's important that we ensure that the quality of care, quality of their life is available to each and every person who works in that industry. And so thank you, John. It was like a great snapshot. I hope for the listening audience that you can relate to what John shared with us, because how about our own situation? How is it that we look to improve our own lot in life? And so here we are, John. You've been working with Centro Campesino now for a number of years now. And lo and behold, during your time at Centro Campesino, something shows up. It's called COVID-19, right? So unlike your predecessors, and unlike the circumstances before you, you've had to experience something that's just utterly difficult and challenging. And so in terms of being able to still be able to, as you said, have an impact on the Latino community, and thank you for sharing the information about the impact you're having, because it really speaks loudly to what's been a successful strategy on your part to be able to outreach and engage in the Latino community, and particularly for farm workers. And we'd love to hear a little bit about, what you've been doing to address those conditions in the farm worker community to help protect them, ensure their public health and their safety and well-being, so as to reduce the impact of this virus that is such a significant pandemic, that it happened here only recently under your watch. And because you're doing such great work in the community, tell us a little bit about what you and your team are doing to address and mitigate COVID-19.
Very good. Fred, just two key points. Context matters. And so as you and I have conversations we've had, it's always important for us to detail what the context is before we get into an issue. So thank you for allowing me to do that. The other is, while there's health disparities, you and I know that you cannot look at health disparities alone without looking at economic disparities, income disparities, and opportunity disparities, which they not only are they interrelated, but they impact each other. So while we look at COVID in terms of helping people deal with the actual virus and the conditions, there's many other conditions you have to look at it. And from our framework, we looked at that. So let me give context to this. So we're in Florida. So in many ways, then at the beginning of COVID, and in some ways today, the virus is still not acknowledged that it exists, that it's an impact to workers, it's an impact to education, to business, or to life in general. I'm not going to go over all the laws that have been passed to ensure, not to help people, but actually to ensure that people aren't wearing masks, that they're not required to wear masks or required to be vaccinated, as opposed to there's other states that are actually passed laws to require people to take care of themselves and each other. Okay, so that's the context. When I remember my staff and I, we had just returned March 2020 from the governor's disaster. It's a yearly event, or it was anyway, disaster conference. That was the last time we traveled. We had heard of COVID. People were kind of making fun. They weren't hugging. People in Florida hug. They were actually pretending to fist bump. Still dangerous. That at that point is when we heard about the COVID, when we were actually providing the information. And many of us thought, oh, it was going to be a short-term impact. The reality is, we all know that it had a much larger impact. Let me tell you about the impact for us in South Florida. It was devastating. Clearly, across in South Florida, particularly, the majority of positive cases were in South Florida, which is the 3 counties to the south, but also the majority of people dying. In terms of my staff, I have a staff of 25 full-time people and about 20 part-time people. And well, thank God none of my staff have passed away. Their families, close to 30 people, whether it's a husband, an uncle, a grandfather, a father, over 30 people passed. And so for our small team, it was devastating for our community. So with the lack of acknowledgement, actually politically, and the resource folks that it existed at the beginning, there were a lot of people that were scared. Not only were they believing the myths that were being shared on television or the radio, but you can imagine seniors in our senior apartments, African American, reminiscent of the Tuskegee experiments on African American folks, without asking their permission and without telling them what the results were. People were thinking that was going to happen again. Seriously, there were other people thinking, seniors, oh my God, if I get tested, they're going to put a chip and track, track where I'm going. It sounds kind of funny now, but it wasn't then, because people were scared. And so in part, they were believing some of the rhetoric and some of the negative stuff. The others, it was their fear running with them of not having information. So right away, my team, and I have an amazing team. So yes, the pandemic, we were not acquainted with the pandemic, but my team and I with one hurricane, my team with several hurricanes, in terms of having to transition and transform and provide services in that framework. This was similar actually to a hurricane. Clearly the impacts were different, but we were able to adjust and to start. What people needed was food, because people were out of work, and there was no cash assistance at that time. There wasn't testing, it didn't exist. And so we jumped into providing the food distributions. We were doing them on a weekly basis. And then we were able to access funding from the Health Foundation of South Florida. We built a collaborative. I failed to mention in describing Centro Campesino, a lot of our work, we don't do it ourselves. There's no way we can have accomplished as much as we do on our own, but we have a long history of bringing people and organizations together for multiplied impact and for great effect. So we built a collaborative. We had a collaborative with a census, a statewide collaborative. We used some of the many partners, found funding, and we started, again, testing was not available. And even when it became available in the urban areas, it was not available in our area. But we started going door to door and distributing information on what people need to do to take care of themselves. And beyond wearing masks, washing their hands. I mean, it's pretty basic. That was the information that we had, but a lot of people did not have access to that. That initial funding was important. This was 2020. By the summer of 2020, my board of directors and I had made a commitment that we were going to raise at least $1 million to provide support that people needed. By December 2020, we had raised 1.3 million. Now, by then also the testing was available, not in our area. We with our collaborative started providing pop-up testing in different areas. It was haphazard at first, but then it became consistent. Sometimes there were hundreds of people in line, and you wonder, oh my God, these people think they're positive, and what are we? But they needed to be tested. They were scared also, so I would say by August of 2020 is when testing started to become available, and we started to provide pop-ups, and we've been doing that throughout. And then by the following year, we started providing the vaccine ourselves, because people were scared of testing and vaccine, of going to an urban area. People were very afraid of the government. Why? Variety of reasons. Well, for those of us from northern New Mexico, the government, what are they going to do? They might steal your land, right? That's an old one that we're aware of. Well, in South Florida, what can the government do to me if they can't help me? My God, is it going to, if I sign a paper or get help, is it going to hurt against on the public charge if I or my family are trying to become citizens? And what is it going to cost me down the road? And they're afraid of the government, but they are not afraid of trusted community partners like our agency or the others that we worked with. So again, the collaborative was important, working with multiple organizations in different segments, focusing on the farm worker community, then expanding to low income, low wage workers, and expanding to a larger population, a larger group to serve, because there were a lot of people in need. So some of the I mentioned food distributions. We are also providing rental assistance, and we basically provided rental assistance, probably a few $1 million in rental assistance actually in the last few years. And we are also providing housing counseling virtually, census outreach virtually, and advocacy testing. And then again in 2021, we started providing the vaccine, and we're still providing the vaccine. We're still having pop-up. And then we also became, this public schools were not open, but we became a hub for the public schools for the kids in our community. And so that they could attend school virtually, be on site at our location, and so that they could earn days and learn the work that they should learn in school, because the schools were not open at that point in time. So we jumped in early, and again, made a commitment. I would say between the beginning of COVID and December of this last December, I think close to 4.5 million is what we raised, and to help people again with a variety of those services. One thing we're providing right now is we have a contract to help people that have been impacted economically by COVID, and they on the verge of losing their home. And we have counselors that are HUD certified to provide that type of counseling and try doing a workout with their lender. We recently applied, not heard anything, to Miami-Dade County with a partner from out west to apply for $25 million to provide assistance, cash assistance to people that have been affected by COVID and they're having issues with their mortgage. So it was about helping people deal with the virus, but also survive and thrive, be able to stay in their homes, in their apartments, and to be able to get some cash assistance and be able to work. And so in many parts of the country, what people don't even think of COVID, it's still with us. It's just in a different transition stage at this point in time.
Oh my gosh, John, if you think about what your services meant to your communities, I was really taken by, your description about the food distribution, and being able to even eventually start to offer the vaccine and to really be on the ground. And I think you said it best, right? We were knocking on people's doors. That grassroots approach is always effective with Latino communities because they get to see you, talk to you, they get to engage with you, they can assess your sincerity, your authenticity, and then the information you provide is critical because then, as you said, if people are fearful, they will tend to gravitate to trying to guess at what's happening or they speculate, but you're providing factual information. And what really it really took me by surprise, John, is something you said. And your organization was taking huge steps to raise funding to help mitigate COVID-19 in your region. And the first thing that struck me was what type of public support or state or federal funds were made available to your organization to help mitigate these impacts, because it sounds like you did something very different. You took a community approach and said, look, in the absence of these resources, we're going to take it upon ourselves with our partners to do that. Is that what I'm hearing, John?
Yes, but let me back up and say, yes, let me back up and say something. Otherwise, my team that did the work are going to be very upset because they did these talking points for me. So our collaborative has made over 73,000 individual face-to-face connections. We're talking about at the height of COVID, going door to door, not entering anybody's home, but in the heat and humidity, if you can imagine South Florida, going door to door with a little packet and with information on where to get tested, where the vaccine, if it's available, and a mask and information. Again, I'll mention over 73 individual face-to-face, non-duplicated contacts, over close to 6,500 COVID-19 tests that there are a lot more tests done by others, but we're talking about what our collaborative did, and over 3,000 vaccines in our collaborative. So it is accurate in terms of funding. Let me give this as an example. The 2020 census, every state had the ability to, this is related, so bear with me. Every state had the ability to apply directly to the federal government for funds. California applied for 245 million. They got that amount of money. The majority of states applied and got money. Florida did not apply for $1, nor did they get $1, nor did they support $1. So the only funds that were available for the census were philanthropy, and public nonprofits and the county government with some tax dollars. And so that's a collaborative that we came up with, that we came up with, and we found funding. We applied directly to foundations out of state, and we made a good argument, and we were funded for 3 years, basically to provide sub-grants to our collaborative to reach outcomes. One of the cool things about that collaborative, so we had funding from a local health foundation. We had funding. We're now funded the last year and a half from the CDC via the Urban Institute, and funding from NeighborWorks and a variety of small grants to be able to do this work. So in many cases, the money's not there, nor is it ever going to be there, but the issues are still at hand. You can't wait for money to be available, and you can't worry or spin around the issue of money. If there's an issue, you need to deal and organize around the issue, and then, if it need be, then go find the resources, whether they're apparent or not. One of the cool things that the Health Foundation did is they funded, along with funding our collaborative, they funded a tech startup, maybe not a tech startup, but entity that's been around for just 2 or 3 years, to create an app where if you inputted the information of a census tract, it would tell you the level of health disparities. So we use that app to focus on certain areas on where we're going to focus initially our COVID outreach in. And so that was pretty cool. Imagine having an app, you input the census data of the tract, and it tells you the percentage of health disparity, taking into account all the varied health disparities that could be there in terms of poverty, health, lack insurance, or lack otherwise. So.
Wow. Well, kudos to your team. And I hope, and I know that there's some of your staff members are listening in today. So this is great. Kudos to you for this valiant effort. And if it wasn't really for the work you're doing, how many people would have been impacted in very adverse ways, right? And because of the loss of life being so significant across the country, in some ways you have helped save many lives, and that's priceless. There's no way to describe that when you take a public health crisis of this magnitude, and I can't say it better than this, is you took it upon yourselves to have a local response. The fact that there was almost very insufficient or lacking state support that could have actually brought federal resources to bear is really a gaping hole in the system, right? Because the question is, how can you support all of your residents? How do you help the individuals who are driving your economies and are the ones who are your home buyers? They're the ones who are keeping the state system and the state economy going. So in light of all of that, I mean, the philanthropic community obviously was able to be of great support to you and all your other collaborative partners. So kudos to them for creating this relationship, this partnership, if you will.
Because you asked about, I'm sorry, you asked about where the funding came from. Let me add this, that CARES Act funding from federal legislation definitely helped to some extent to provide rental assistance and also to help with vaccine and other issues. Now, if federal money, it did flow through the state and through the governor's office and state, but it was federal funds. That helped substantially. It did. So I want to note there that there were points of federal funding as well.
That's awesome. Well, you're absolutely right. That was the purpose of those resources, right? To be able to flow down to the community, right? How does money come? In many instances from the top down, right? But the point is, does it get to its destination? So my question is, how did resources go into the farmer worker community, right? Because you have to make lots of choices, right? The Latino community who's being impacted, and oftentimes you serve many other groups besides Latino communities, not just limited to Latino populations or farm workers, right? So how did resources go into the farm worker community, John?
Well, so let me tell you this first of all. And again, context is important. We have an amazing team, and you know the teams that you've worked with your members in California, Texas, Washington, D.C., Fred, and New Mexico. In South Florida, I can tell you, have an amazing team. We Latinos from at least 12 different countries, okay? African Americans. I will tell you, a handful of my staff were born in the US. The rest were born in other countries. It's amazing. Prior to COVID, we would have at least once a month a potluck, and we'd sometimes focus on one or two countries at a time. Oh my God, the food was amazing. You can't imagine how many versions of tamales that there are. They're all different. Whether it's hayaca from Venezuela or anyway, I'm digressing to food, getting hungry. So those same demographics of our team is accurate in our community. We have people from all over the world, Latinos from all over the place. Now, in terms of how does funding flow, let me say this: not a lot of funding flows. Agriculture workers in general across the country, they're an afterthought. Their work is needed and wanted when there's produce, fruits to pick, or items to clean. But in terms of housing, they're an afterthought. In terms of education, not well thought of, and in terms of access to resources. So in terms of the agricultural community accessing resources, it was extremely difficult because the initial resources that were available to provide rental assistance, they were very restrictive in terms of having IDs and residency requirement, not just the fact that you've worked here for years and you have an issue. So it took some time to access resources that were more flexible. Also, funding organizations in the community that work with different segments. There are different segments of the farmworker community, and different Guatemalan speaking groups in South Florida as well that are agricultural workers, funding them, providing sub-grants so that they meet objectives that we set, but they're creative in doing it the way that they're uniquely qualified to provide their service. So it's always a challenge to access resources, particularly for agricultural workers, to focus on the agricultural community. It seems that in many times when there's legislation, it helps farm owners, it helps employers, but the employees and the people that actually do the work on the ground, many times are an afterthought. It's very challenging to access those resources.
Yeah, excellent point. And well, I'm actually kind of happy now looking back that NABA was able to provide some support to your efforts, because now that I really see the bigger context, as you've said, it stands out for us, why it is that we wanted to engage with you is what we refer to as a cultural broker, right? Organizations who are trusted in their communities, that are already very engaged in their communities, already know exactly how to effectively be of support to the families that come to you for services, or that you provide services to by going to them, right? And when you describe for someone exactly how that would look like, right? We oftentimes don't know, as we've never been to a farm, we've never been to a ranch, we've never been out into these areas that are considered the agricultural areas in our counties or in our states, and so we don't really have any familiarity with that. What we see is what we see in the grocery store, right? But where is it that these places are? Well, they're in rural areas, right? They're in parts of the state that many of us have never even stepped on, right? And there you are engaging with those communities in their space, in their place, because part of that is that's where people are, right? So you're really going to them and kind of describe that. That's something that many people in the country don't really understand, right? They can't fathom it, they don't see it, they don't do it. But kind of walk us through that a little bit. This is a very powerful opportunity, because how you do it, for instance, using promotoras or your outreach staff and engaging with those communities, maybe at a migrant seasonal head start program. I mean, what does that look like? Give me an example. Kind of walk us through that, John, because, many people in the country don't really know what that's like. So
let me give you a visual first. And I think this is an issue we've had for many years across the country. I know probably with our children as well, is with all the technology that's available, kids are in front. If it's not a phone, or a screen. Maybe for us it was a television. That has kind of provided challenges to getting people connected and communicating. I know that when I was growing up, it was be productive or go cut weeds. Vas a poner a trabajar. People aren't connected to the outside. There's so many young people that their connection is to what they see at the grocery store and when they're buying a steak or buying vegetables. But the reality is, like you said, in many of our communities, you don't have to travel very far, whether it's from Abiquiu, where you grew up, or whether it's where you live, or even in South Florida. You don't have to go very far, but you have to make the effort to go out there. I think for us, though, having a connection, individuals in our board that live and work, that are part of the farm worker community, having individuals on our staff, and actively participating, having actions that is by design, not by default. What I mean is structured and planned, as opposed to, oh, maybe it happens. Whether it's taking AmeriCorps youth to have an event, a cleanup activity, or some kind of activity on a farm, or whether it's going to a farm and picking for a few hours just to see what it's like. And would you really want to do that job? It's very hard work. I think it's an issue that we all have. It's an issue that we all probably need to look at in terms of providing opportunities for youth and adults. It's not that difficult, but it does take some planning and some action. I hope that helps in terms of what it looks like. Well, for us, I mentioned to you before we started that our office, the building behind us, it's in the middle of the Everglades. We're in Florida City, a few miles to the entrance to the Everglades, a few miles away from the entrance to the Florida Keys, and all around it's rural, it's houses. You hear animals around, but there's also farm activity and farm. It's not that far. We are, as the crow flies, 20 minutes from Miami. If you drive, it could take you 35 minutes, or it could take you 3 hours, depending on traffic. But I think it's an issue that we all have in terms of ensuring that our kids are connected to where our food comes from and our food source. And it's not just the store. We're not just Fred. It's a term we used to use years ago. God, that we're not just spenders, spending money and buying stuff, but we're actually producing something. Whether it's something of everything has value. Whether it's growing corn, or whether it's growing or developing something else, that we're actually producing. We're producers instead of just spenders.
Yeah, well said, because one is, in large measure, all of American society's origins were from agricultural communities, right? It's just that the migration into urban centers has, over the last 125 years, taken such a shift from how we have had to deal with such population growth and economies that reflect, something that's just huge in this country, right? The agricultural business is very big in the United States, but then ultimately, how do we support the workers and the consumers, right? And that's just as important. You can't have just a business. You have to have people you market to, the customers, the people who are working for a living to support our nation, right? So this is incredible. I want to share a thank you to you by Raquel Costa, who's, she's very close to us. She follows us very closely on social media and Facebook. So she sends you a thank you, John. And I also want to say thank you, as we're now already going through all of our questions real rapidly. You really have gravitated, for our listening audience, the things that are unique to your organization and the work that you're doing there. So if you think about where we're at now, so here we are, 2023, John, and what has been happening for the last 3 years. If you think about it, we're now approaching a new anniversary date for COVID-19. What do you see, given what you're seeing take place now? What changes are probably going to occur from here on out? How is your organization going to see this environment change in a way that you adapt to? So kind of give us a little forecast about what you're seeing happen or about to happen.
Well, so I would say some of them are technical changes and some are more structural. So technical, for instance, the resources available to help people to do marketing. And so people are knowledgeable about COVID and to access the vaccine and get testing, that money is going away probably by this summer. So that's going away. A lot of the focus on, and this is technical also, is also dissipating. Structurally low, when we look at how Florida's responded, and I'm not talking the whole country, I'm talking about Florida. It's I would say it was bad at the beginning, and it's approaching to get worse because that lack of response, lack of acknowledgement, that is filtered over to several other issues as well, beyond health disparities and beyond COVID. I'll leave that there. Now, in terms of our organization, we've a lot of the staff, look, we're dependent on funding, just like any other business, and access to it. When we need case managers and we have access to resources, we have case managers for a hurricane. Once the funding is over and the work is done, we reduce that staff. At this point in time, we have one part-time staff person and a director that does a lot of the thinking around this work, and that are active on this. The other staff aren't on track anymore. The sub-grant funding that we had won't be available to sub-grant to groups after this summer. Now, in terms of the issue of COVID, it's transitioned. COVID is, it appears that it's never going to go away, but we'll have to deal with it in other ways. I don't know if that's going to mean a once a year vaccine, or I'm 7 months ago is when I had my booster, so I'm getting close to a new booster. If it's available, I will take it personally. I did not want to take the vaccine, but I managed what could happen if I didn't take it and what could happen if I took it. And cost benefit analysis, hey, I've taken every vaccine that's been available for COVID. And I don't tell people, I don't make people, but I strongly encourage them as much as I can to take care of themselves and their families. So in terms of that work, so we're still seeing health disparities impacting people, the economic disparities, and we have our focus on increasing our ability to help young kids be successful in public school, and expanding that ability. And again, it's not just about health disparity, it's about economic disparity as well. We're looking at opportunities to ensure that college is not for everyone, but education is for everyone. How individuals can access real training that they can use and make money, not just, oh, here's a training and it's never going to be useful. But we have a training. In fact, the classes every Tuesday. For the next 6 months, we have a class in Spanish. It's the first step in a certification for an electrician. It's not, you're not certified after the class. It's the first class, and it's a certified course, and it's full. And so we're focusing on helping people to to access a home. Prices of homes are expensive, they're outrageous. The interest rate is high. It is still cheaper to pay for a mortgage than it is to pay rent. Rents are outrageous. So we're looking at creative ways of ensuring that people can get into a home and be able to keep that home. So we're focusing on economic prosperity and again, not just people help them survive, but they can thrive and succeed as well. If another, God forbid, there's another pandemic, but it's more likely there's another hurricane, we will adjust accordingly, just like we have.
Well, that adaptability and flexibility is what usually makes nonprofits effective, because they can do these things much quicker than oftentimes the public sources themselves, right? Because one is there's less bureaucracy, the leadership innovation of nonprofits and community-based organization is an asset to this country in order to be able to mobilize and meet the needs in whatever area of service that they deliver. Well, I only have one other question, and John, and then we're going to turn over to you to kind of bring us home, right? And what takeaway you want folks to have from today's session. But I've been putting myself in your shoes in part to imagine what the mental health impact of COVID has had on the farm worker community. And because even though we ourselves oftentimes may not be a behavioral health agency, we see it, we feel it, we know it, and we have to call it for what it is. It impacts people's well-being, right? And because, the emotional aspects of fear alone, right? For some people can be very traumatic, complicated bereavement, from the loss of the loved ones that you've lost. And then now the recurring anniversaries of that loss. I mean, what has been the mental health impact on the farm worker community, John? And then we're going to turn it over to you to wrap us up. So, but let's end with that final question.
Whoa, Fred. So clearly the term pinche miedo, it's real. It is. And it affects everybody in different ways, in different aspects, at different times. But those individuals that are at the lowest rung of the economic scale, that make the least amount of money, that don't have health insurance, a loss of a month of work, you lose everything. You not only can't feed yourself and your family, you may lose your home, but just, but what the reality is that many people today, even middle income people, what is it? They're $400 away from losing everything. That's the reality these days. So if that's the reality in the general population in our country, when we look at agriculture workers and their situation, whether they're documented or not, they have aspirations. They want their kids to go to school. They want their kids to do better than they have. It has been an impact. There has not been sufficient resources to deal with the behavioral health issues. There never has, whether they're youth in general or whether they're adults. It's been traumatic in many ways. We can chat offline about this. Look, we are not a behavioral health organization. It's not in our mission, but we definitely want to help move the needle in terms of more people in our community being able to access services in a safe way. Calling the police, that's not help for behavioral health, right?
Right.
You know what I mean? But in terms of helping people, if there's any way you can help people or help another organization access resources to help people, it's pretty much not available. I'm not saying it's non-existent, but it's not that available.
Well, all I could say is this has been a powerful time with you, John. I always enjoy our Pláticas, because if you think about it, we have Pláticas that don't ever show up on Facebook, right? Because the work that you do and the work that Nalba does, we just, we have a lifetime commitment to these issues of serving the Latino community. And it's been such a pleasure to have you here today, So now you get to wrap us up, John. And you bring us home right now with all that you've shared and demonstrating what impact you and your team have had. And again, kudos to your team for getting you to this space here with whatever material they prepared, and you're delivering it, and then you expressing it in the way that I think you have always done effectively, which is it's very fact-based. It has a context, right? Because at the end of the day, is people understand what it is that they're doing to help our community, right? Because if you don't know what we're experiencing, then you don't really know what you're doing with your resources. And I think you always make the argument for how it is that we can help our community more effectively, because really the help up is really just that, right? Is to be able to give people information, education, access to resources, the things that anybody in this country generally can have access to. But is it possible? And your organization makes that possible. So take us home, John. I mean, what's the takeaway you want the listening audience to get from today? And then keep in mind, we have recorded this session, so we're going to continue to play the recorded version of it. And we'll encourage you all to add more comments to the chat, because the views we get from this continue to grow, and we want to be able to let people know about the work that Centro Campesino has done. And again, this is John Martínez, who's the executive director for Centro Campesino, joining me today for Latino wellness during COVID-19. But we're going to go ahead and now turn it over to you, John, here for the next few minutes just to wrap it up for us, okay?
Okay, so
Go
I'd
ahead,
like to
John.
thank Barbara, Susana, Warith for their work, and former staff and the leadership team of Centro Campesino, and of course the board for all their work. Their work is simply amazing. So I would say I was asked to provide one takeaway. I actually have three. They're pretty simple, but they're also very easy to forget about doing. I would say one is listen to people. Sometimes the solutions we come up with are excellent solutions, but by listening to people, we might find out that people actually need something else right now, and your solution may not be what they need or what they want. And so that's one is make sure and listen to people, and not just people in front of you, people in the community. The other is extremely important is collaboration. I know people use that buzzword all the time. And yes, in our history, we have a history of bringing people, it's our tagline, bringing people, individuals, and organizations together for multiplied impact and effect. So it's a tagline, but the reality is it works. Why? We're not brash enough to think that we can do everything ourselves or that we know everything. And the reality is other people have ideas and they have strengths that you may not have, and bringing people together. And if you can find funding and help those organizations as well, that's excellent. But collaboration is real important. And I don't mean collaborate with everybody or anyone. Well, you should collaborate with everybody and anybody, but I'm talking about high impact organizations, those that bring something to the table, that they have unique characteristics, unique strategies, and help them with funding and help them move forward. You all move the needle forward together. And I would say, lastly, I think I mentioned this earlier, don't get stymied in the fact that funding isn't there. Because if you wait for funding to fall from the sky, it's like a friend of mine years ago, he really wanted a relationship really bad, but he was like waiting for God to drop him something, and you know what I mean, friend, drop him something. It's the same thing with funding that you need. The reality is, if you don't focus on the funding, focus on the need and the strategies and what you want to do, and then find the funding for it. I mean, sometimes the funding will come, that's excellent, but my experience, funding isn't always the first thing that happens. It's the animo, it's the strategizing, it's the work, it's talking to people and coming up with a plan, and then finding the funds. So those would be my takeaways.
Well, see, you already used the multiplier effect, John, right? You said, I don't just have one, I have three things, Wes. That's the way you think, right? You say, wait a minute, there's a lot of ways to impact these things, right? And so again, as a reminder from John, he says, one is listen to people, because their ideas or solutions may in fact really be more relevant and may actually in fact address the issues that are at hand, right? People like to talk about problem solving, but sometimes they're solving the wrong problem. So the people who can identify the problem are the people that you're listening to. So ahí está un consejo. The second one was collective impact. I think that's the terminology we use today. But if you think about it, collectivism is actually part of our natural support system, our values and beliefs as a Latino community. Everything we have done has been built by the systems that work for us, because oftentimes the best support we get is from those institutions, agencies, and groups that are there to be of support to us, right? And so that collective impact of our families, our communities, our extended families, the faith community, all those people that have been part of our collective network for generations, not just recently, but for generations, is in fact how we think. We know that sometimes the best way to leverage what we're doing is to help each other, right? So if I have to move a ton of dirt, it's a lot easier to have 20 of us moving a ton of dirt than just one person, right? So just envision how we can make things more efficient and more effective through John's suggestion of collective impact. And then you're describing a reality for the Latino community is the lack of funding. If we relied just on funding to solve our problems, we would probably continue to have problems, because what we didn't do is we didn't act on trying to address the needs. 'Cause sometimes what we can do with the existing, I think you said it best at the beginning, the sweat equity that people bring to the table, right? That's an asset. And the human capital that's there in the Latino community is invaluable, right? So with those three things being shared today, John, I want to say thank you. Muchísimas gracias a ti, to tus trabajadores, your team there at Centro Campesino. It's been a wonderful plática with you today, and we're going to continue to highlight the work you've been doing. It's important that the nation understand that the farm worker community, groups like your own, have been there for years, doing the work in a way that people trust. And I want to say muchísimas gracias. And for those of you, we look forward to you at our next plática. So please join us, and please say thank you to Mr. Martinez on the Facebook chat, because I think the information he and his team shared was invaluable. With that, muchísimas gracias. Have a good rest of the afternoon. Adios.
Thank you, Fred. Thank you for the opportunity.
You're welcome, John. Absolutely.